To begin, what is the deadlift? The deadlift is one of three powerlifting movements in the competitive strength realm, in which the individual initiates the movement by pulling a barbell vertically from the floor, and the movement is completed once an upright position is accomplished. The deadlift is classified as a discrete motor skill, as there is a definitive beginning and end point for the movement. It is considered a gross movement as it incorporates the use of large number of muscle groups, as well as characterized by the absence of precise movements and hand-eye coordination. The deadlift is a closed motor skill, as both the environment and object are within the individual's control and are not subject to change.
Okay, moving on to the two-dimensional skill classification. The deadlift is classified as 1B in reference to the Gentiles taxonomy chart. As we can see, the body is stable with an object in motion. There is no inter-trial variability present, as well as it being in a stationary environment. In order to prepare for the deadlift, there are many phases we need to break down. We're going to start off with the setup stage. There are many varieties of grips an individual can use to perform the movement. As we can see here, this is an example of a double overhand grip. There are also different varieties of grips, such as the alternating grip. Now focusing on feet positioning. Typically for a conventional deadlift, it is shoulder width apart. But as we start to increase the distance with a wider stance, the exercise starts to become a sumo deadlift instead. Once you have learned how to set up, it is time to move on to the initial pull. The initial pull starts off with the bar ascending upwards from the ground. In this initial stage, a neutral spine should be kept throughout the whole movement, with your chest being in an upright posture. At one point, the bar will begin to pass the level of the knees, and this is a transition into the lockout phase. The lockout phase will require reinforcements of the hips to help out with the lockout. At this moment, the individual must thrust with the hips as well as squeeze the glutes at the end of the movement to ensure a proper lockout has taken place. As we learn a new motor skill, there are three stages of learning we must encounter. The first being the cognitive stage. This is where the learner encounters cognitive problems and must integrate information. There is also a higher chance of error and variability in performance. Moving on to the associative stage, performances are now becoming refined, with error percentages decreasing. Learners can now detect their own errors and make associations between environmental cues and movements. The main goal for a learner is to progress to the autonomous stage. This is when the learner can perform the motor skill in an automatic manner. As a beginner, it is more likely to be prone to producing the movement with bad form. Here are a few examples. As you can see in this clip, there is a clear indication of a hyperextended lower back. Misinformed information to beginners can lead to this situation. Locking out the deadlift in this manner can lead to spinal injuries. To avoid this, maintaining a natural arch instead of having an exaggerated arch during the lockout is crucial for injury prevention. Moving on to the second clip, the individual is experiencing rounded shoulders during the lift. This occurs when the body can no longer keep a neutral spine position. There are many factors that could have influenced this, such as the weight being too heavy, or the individual not being familiar with this particular motor pattern. Okay, so a good way to indicate good form is to use a dowel, and the purpose of this is to have 3 points of contact with the stick. Okay, as we can see in this position, my lower back, upper back, and the back of my head are all in line with the stick. Using this indication can be a representation of a practice tool.
As for verbal cues and instructions, we utilize both visual and kinesthetic cues and instructions. Words such as look, see, feel, and touch, as well as demonstrations and guidance, all aided in the development of a profound image inside of the individual's head to set a guideline for the individual to follow and learn. We utilized a whole, part whole practice strategy as a way of reducing the complexity of the deadlift through initially introducing the movement as a whole, educating the learner on it, then breaking apart the movement to build and refine form and technique. We then reintroduced whole practice to smooth out the edges when performing the movement as a whole and reinstated its implied setting. When teaching the deadlift movement, we utilized modeling to support skill acquisition. While instructing the movement, we incorporated verbal cues and demonstrated appropriate form and technique and outlined the significance of learning the phases gradually as not only a form of reinforcement, but to also act as motivation to learn and better perform the movement through positive reinforcement. This leads on to guidance hypothesis. We specifically chose the aforementioned feedback strategies to aid in the reduction of learner error while simultaneously providing beneficial feedback in which the learner would not rely upon to perform well. In saying this, we appropriately balanced individual performance with feedback to ensure there would be no detrimental effects on learning caused by a heavily guided feedback system. Now moving on to augmented feedback, specifically the knowledge of performance, which can be regarded as qualitative, was rationalized due to its applicability to provide qualitative terminal feedback given at the end of the performance in regards to the deadlift's desired technique, as well as to facilitate error detection. However, concurrent feedback was also administered at points where the individual lacked intrinsic task feedback. This gave the ability to identify corrections when the learner was hesitant on what phase to process next. As for motivational strategies, goal setting was implemented as a motivational strategy to augment motivation and sustain the attention of the learner in the hopes of increasing overall performance. Goal setting was also projected to ensure that the learner maintained focus and mental perseverance to continue to pursue the goal. The purpose of this was to foster and facilitate intrinsic motivation.
A peer review strategy consists of working in a group or having a training partner. The benefits of having peers around during training sessions is so that peers can review each other's forms, point out certain errors, and motivate each other. Through observation of one another and training together, this can help foster intrinsic motivation.
For the distribution of practice session, we established 3 days a week, separated by 48 hours in between training sessions. Specifically, we targeted 3 distinct performance goals on each day, 1 being technique, 2 speed, 3 strength.
Further training methods can be applied once the learner is comfortable in the autonomous stage of learning and can perform the movement in an automatic manner. For example, adding in exercises such as deficit deadlifts and rack pulls to primarily focus on segmented phases of the deadlift to maximize performance.
In order to foster positive transfer, we need to effectively communicate and create a learning environment which facilitates a positive transfer. This has been applied through the transfer of appropriate processing theory. A learning style best suited for this is segmentation, where you break down the whole movements into segments, in which this aims to break down the motor skill in order to be applied and transferred to the real-world scenarios through easy-to-digest phases and cues. The aforementioned measures of performance will be used to determine retention and applied to transfer testing. For the retention of information, the individual will undergo a pre-test to assess and measure the individual's innate ability, a post-test to measure the individual's ability after the 5-week training program intervention, and finally the retention test, which will be administered within the first week after the completion of the training program. And this will help to identify and measure the degree of information and physical ability preserved. As for transfer tests, if we can identify a positive change from pre-test qualitative data, such as form and technique, to the retention test, it is plausible to assume that the individual has developed a level of skill and can thus be acknowledged as having learnt the deadlift movement.